This is a very short recording illustrating my experience of my local GP surgery for the last 18 months.
Thank you for calling. Please note all calls are recorded for training and monitoring. If you feel your call is a medical emergency, such as shortness of breath or severe chest pain, please hang up and dial 999. If you are calling regarding a non-urgent issue, we ask that you please consider other options.
Okay, so from that we can establish that if it's urgent, I should dial 999. That makes sense, except there's probably a 2 or 3 hour waiting list for 999 calls at the moment. Otherwise, if it's non-urgent, I shouldn't speak to the GP. If it's non-urgent medical matter, I shouldn't speak to the GP. But I should consider other options. Well, what are those?
Such as self-care or speaking to a clinical pharmacist.
Self-care or speaking to a clinical pharmacist. So, don't come to the doctors for non-urgent matters. Go and see the pharmacist or deal with it yourself.
Although we are now emerging from the worst of this pandemic, general practice demand and workload remains higher than ever.
This surgery, like most surgeries, has been closed throughout the pandemic. They may well have been doing some house visits, but I've never seen them. And I've never seen anybody else or know of anybody else who's ever seen them. So exactly what have they been doing through this pandemic other than administering thousands of vaccines for a bonus 2021, bringing in tens or hundreds of thousands of pounds?
Despite high numbers of vaccinations, it is crucial that we continue to minimise the risk of transmission where possible to protect our patients and staff.
Why would you go into medicine if you're scared of catching the flu off your patients? Perhaps you should have gone into accountancy or maybe become a lawyer.
For this reason, when requesting an appointment with the GP, you will initially be booked in for a telephone consultation to allow the clinician opportunity to collect the relevant information needed to minimise the close contact time required should a face-to-face appointment be clinically indicated.
Okay, I've got no problem with triage if it makes things efficient, but having done this for a relative, I can tell you that you end up speaking to a receptionist, you tell them the issues, and then she speaks to the doctor, and the doctor prescribes a drug.
The next person that you speak to will be a trained healthcare navigator,
aka 18-year-old receptionist.
They have been instructed by our GP team to ask them questions regarding the nature of your problem, which will be treated confidentially and will allow us to guide you to the most appropriate person or service to help you. Thank you for your support and understanding.
Well, no, you don't have my support, you don't have my understanding. Why are we still paying GP surgeries